There are 4 types of studies in the review: included, excluded, awaiting classification, and ongoing. Each category of studies has a special table where you provide the attributes of the relevant studies. These tables are what we call the characteristics of studies table. To enter study characteristics, locate the table in the outline. Double-click the study for which you wish to enter the data for. The characteristics of studies table will open in the content pane. Move your cursor to the first field in the table and enter the characteristics. Tables for the 4 types of studies have some predefined standard characteristics, like what we are saying here for included studies. But you can also add up to 3 user-defined characteristics for each study category. To add a user-defined characteristics, open the table properties. Select up to 3 user-defined characteristics and enter a heading for each character. Click on OK to save the changes. Studies in characteristics of studies table can be ordered in 3 ways. The default setting is to sort them alphabetically by the study ID. You can also sort them by year and by a user-defined order. To change the sorting order, go to Table Property again. Double-click on the property. Choose the order you want from the Sort By pull-down list. It is relatively simple to use the table, but not as so simple to decide on what information to put in. Review authors must decide which characteristics of the study are likely to be relevant to users of the review. It is likely that most of these characteristics will have been outlined in the review protocol. Review authors should include the following information as a minimum. For example, when you're completing the method section, try to include the study design, stating whether or not the study was randomized, duration of the study, the setting of the study, for example, whether it's inpatient or community patient. When completing participants' information, provide relevant details of the health status of the participant, their age, sex, country. Sufficient information should be provided to allow users of the review to determine the applicability of the study to their population. As to the intervention section, a clear list of intervention groups included in the studies should be provided. For drug interventions, please include details of drug name, dose, frequency, mode of administration, duration of the medication. For non-drug interventions, please include relevant considerations and components related to the intervention. The outcome section is not for you to report the study results here, but for you to provide a clear list of either the outcomes from the studies that are considered in the review or the outcomes that are measured in the review. The note section is for you to provide further comments from the review authors on aspects of the study that are not covered by the categories above.